This is Dr. Daniel Paul with Easy Orthopedics, and today I want to talk about how you can know if you have a stress fracture in your foot. So stress fractures, in the foot or any other area, they are legitimate fractures and breaks. The bone just hasn't moved at all, and it's still perfectly aligned, and there's essentially a crack in it. But for all intents and purposes, it's broken. And the question is, how do you know if you have one? Maybe your foot hurts, you've been running a lot, maybe you're a competitive dancer and it's been hurting. How do you know? Well, the first thing to do is usually when you have a fracture of your foot, it'll hurt when you walk on it. When you're not walking on it, it usually doesn't hurt at all. Now that could be a lot of other things in the foot, but general rule of thumb, stress fractures hurt when you use it, and when you don't, they don't. X-rays can be helpful if the stress fracture, and if it's been a little bit of time, let's say a few weeks, sometimes you'll start to see callus formation around the bone, and you can say, yes, you did have a stress fracture of this bone. The difficulty becomes if this pain hasn't been going on for that long. You get an x-ray and it's normal, but your foot still hurts. Now what some people do is they'll wait a couple weeks and get an x-ray and then see if there's callus and be like, yes, you did have a stress fracture. But that's one way that works fine for some people, but for other people it doesn't. Maybe they need to walk around, it's causing them problems. Maybe they're a competitive dancer and they need to take time off. They would need to take time off. So the real way to tell if you have a stress fracture or not is to get an MRI of your foot. And what that'll show is that'll show a lot of fluid in the bone, and it'll actually show that crack that you'll see on MRI. And that's usually the most sensitive and specific way of determining if you have a stress fracture. And stress fracture is also a spectrum. Well, the spectrum ends with the stress fracture, and then I guess movement of the fracture, and then more obvious fractures. But you can also have something called a stress reaction, where the bone hasn't quite broken yet, but there's a lot of fluid in it. And usually if I see someone with that, I'll recommend they take time off from the activities that they do before it breaks, so the overall recovery is faster. And there's a lot of different stress fractures of the foot. You can have a stress fracture of the metatarsals. That's the most common, especially in dancers. Usually you can walk on those depending on what you do and just wear a fracture shoe. You can have a stress fracture of your navicular bone, which sometimes requires surgery or at least requires casting and non-weight bearing. You can have a stress fracture of your calcaneus. So you can have it in a lot of different areas. But yeah, if you really want to know if you have it or not, get x-rays. If that doesn't show it and you're still concerned, then an MRI is a decent option to show whether you have this or not. And then once you get the diagnosis, depending on where the stress fracture is or isn't, then you can start getting adequate treatment. But a lot of people end up getting stuck in this phase where like, is it broken, is it not? And I know it can be certainly frustrating. So I hope I was able to answer your questions about stress fractures in the foot and how you know if you have one. If you have any questions, feel free to leave them below. I'll do my best to respond. Please like and subscribe, and thanks for watching my video.